Anisa, e gati për ndërhyrjen?
Më gati se kur.
Si ndihesh ke emocione?
Pak, ama jam shumë e lumtur që pe heki gojle një sen që më ka bo dëm të kalumen e ta shtardhën e di që kam e jetë sigurt dhe kam e punë e lumtur. Faleminderit Spitalit Amerikan.
Our patient is Anisa Veselit. She is a well-known singer in Albania, and she has scoliosis. She has a lumbar scoliosis. We are going to correct that scoliotic deformity today. What we are going to do is to do a selective lumbar fusion. The aim is both to correct the deformity and also to preserve the motion of the lumbar spine, which is necessary for her stage performance. Also, she needs to sing, she needs to dance, and we are trying to do our best. And at the end of the operation, we are going to speak again. The operation will be done from the back of the spine with a longitudinal incision, and we are going to use titanium screws and rods to correct and stabilize the deformity. We are checking with the CR. Right now, we are checking the levels here, and we can see that L3 is appropriate for our lower end. The examination under anesthesia is important. That's what I'm doing right now. And we are going to choose that level as our below stopping level, lower end of construction, and we'll go up later on. We have stabilized the system, and we did the fine-tuning to try to achieve the perfect balance possible with this technique. Now we are going to check it with C-arm fluoroscopy. That gives us an intro of the implants and the bones and the amount of correction that we achieved.
Doctor, what was Anisa's diagnosis?
Anisa had a scoliosis. It's actually a double scoliosis, but it was primary, a lumbar scoliosis. It also resulted in shifting of the body to the left side. So that's a primary lumbar scoliosis. That was her diagnosis.
What kind of technique did you use?
But because the angle was already 46 degrees in the lumbar spine and there was a trunk shift to the left side, we decided for a surgical treatment. We used a posterior approach. We approached the back from the back, and we used titanium screws and rod systems to stabilize the spine and to pull it into the middle to correct the deformity.
How did the surgery go?
It went as planned. We did a selective lumbar fusion. It's a short segment fusion. We did not touch the majority of the spine because she is a singer. She also needs to dance. So we left most of the spine untouched so she can move more freely. She can start walking. She can start mobilizing even today.
Will she now be pain-free?
There will be some pain. I mean, just like every operation, there will be some pain. But eventually, after the healing is finished, she will be either pain-free or will have very little pain. But the important thing is, she'll be able to move freely.
When will she come for a follow-up?
Normally, we keep the patients at the hospital for about 5 days. And then, after they go home, we want them to come for follow-up for a wound check after 3 weeks and for an X-ray follow-up after 1.5 months. After 1.5 months, we extend the durations. 3 months later, 6 months after that, and 1 year after that.
Can she get pregnant and can she have a normal birth?
Yes, she can get pregnant like everyone else, and she can give normal birth like every other young girl.
Can she continue now her career?
Yes, of course. That's why we chose a limited approach. We involved only 5 levels of the spine, so the majority of the spine is free, so she can continue her career.